Hello, my name is Kelia Emery, and we're going to be talking about cardiovascular disease today, specifically DVT and PE. So DVT stands for deep vein thrombosis, and that is a blood clot in the vein deep within your body. More commonly, they're found in the lower legs, thigh, and groin, but they can be found in the arms, brain, intestines, liver, kidneys. So a PE is a pulmonary embolism, and this is when the blood clot breaks free and travels to the lungs. This is when it gets life-threatening because usually DVTs aren't life-threatening and are easily treatable. But when you have a pulmonary embolism, it becomes a lot more serious and a lot more urgent to treat. Okay. So per WebMD and the Cleveland Clinic, they both said that usually there aren't a lot of symptoms with DVTs, but I've worked in healthcare for the last 10 years, and normally WebMD constantly tells me that I have cancer when I have a headache and just haven't drank any water. But I beg to differ a little bit with the DVTs. There are signs and symptoms, and from working in healthcare, it's one of the things that we work really hard to prevent from happening. And we're also really cognizant, and I don't know if that's just maybe like a healthcare standpoint from something that we're trained to look for and something that we train to know, but from my perspective, there definitely are symptoms, and some of them, and most commonly, one of the most common symptoms I've seen is swelling in the leg, which is why I included the picture, because it does turn red, almost like cellulitis in a sense, but it's more the trunk of the leg and or the upper leg, and it also gets warm to touch, and it sometimes does get red, and it does come on pretty sudden. When you have a pulmonary embolism, this is characterized by chest pain, shortness of breath, or coughing up blood, and these are urgent symptoms that you would want to go to the emergency room for. Okay, so some of the risk factors are a family history of genetics of pulmonary embolisms or DVTs, birth control pills, and I believe it's specifically birth control pills with smoking tobacco. So the risk of DVT with specifically only birth control pills isn't as high as the risk for when you include tobacco while you're on birth control pills. A sedentary lifestyle, overweight. Again, that goes hand in hand with a sedentary lifestyle, because if we are sedentary, sometimes we tend to be overweight and have other health problems, and that can lead to a higher risk of DVT or pulmonary embolism. Tobacco use, and again, with the birth control pills, your risk is significantly increased when you do smoke tobacco while taking birth control pills. Injury or surgery that limits the blood flow. So one of the things that I did want to talk about too is that most hospitals, if not all, when you are inpatient, they have these leg sleeves that are called intermittent pneumatic compression devices. And so what they do is for all of the patients that are bedbound, and even patients that aren't constantly bedbound, they still place them on, and it supplies compression to the legs at intermittent times. So you plug it in, and every so often it'll blow the leg sleeves up, and basically this stimulates blood flow to the area, so it prevents DVT. Because when you're already having surgery, if you're on blood thinners or coagulants or whatever it may be, there's you're not moving around, you're not getting out of bed, you're healing, your body's healing, and so this basically prevents DVTs and from also pulmonary embolisms from forming. Okay. So one of the biggest treatments is lifestyle changes, and nobody ever wants to hear that, but taking care of yourself is the best way to prevent from having blood clots and pulmonary embolisms. Tobacco cessation, so smoking and not smoking, would be another step to not having blood clots, as tobacco can cause blood clots. They do offer procedures and surgeries. Some people who have varicose veins are at a higher risk of getting DVTs, so they do offer surgeries and medications where they remove the varicose veins to prevent you from getting DVTs. And then they also have medications for people who, when the lifestyle changes and tobacco cessation don't work. And that leads us into prevention. So avoiding tobacco products totally is a great way to prevent any kind of blood clots from happening, because if we're not smoking, then we don't ever have to worry about getting blood clots from smoking. Maintaining other health conditions such as like diabetes, any kind of heart conditions that you already have. By treating them and making sure that the rest of our body is healthy, we can also prevent blood clots from forming. Reducing and managing stress, which is so easy to say and so hard to do because we're always so stressed. And then watching sodium intake as well as exercising. So I think a lot of times we forget that your heart is a muscle, and that we do need it to exercise in order to be healthy. And so by doing cardio, even just like walking, is a great way to prevent any kind of health issues or DVTs, blood clots, pulmonary embolisms, even just getting out there and walking, moving your legs. That way you don't ever get blood clots in your legs. And then you're also exercising that muscle because your heart is a muscle. And that's it. Thank you.